In a mastectomy, the entire breast is removed. In a simple mastectomy, only the breast tissue is removed. Your surgeon will begin by making an incision to remove an oval of skin, including the nipple. The breast tissue will be separated from the skin as well as the underlying muscle and removed for examination. Finally, your surgeon will insert drains to prevent fluid collection. A modified radical mastectomy is a procedure where your breast tissue is removed, along with some or all of the lymph nodes under your arm. A sentinel lymph node biopsy is typically performed in addition to a lumpectomy or a mastectomy. It may be done if a clinical exam or imaging study shows no evidence that cancer has spread to the lymph nodes. The purpose of the biopsy is to identify and check the first draining lymph nodes from the breast to make sure cancer hasn't spread there. To do this, dye will be injected into your breast to determine which lymph nodes are the sentinel lymph nodes. Your surgeon will remove 1 to 3 sentinel lymph nodes for examination. If these nodes have no cancer, it is unlikely other lymph nodes have cancer. If these lymph nodes have cancer, the rest of the lymph nodes under your arm, called axillary lymph nodes, may also have cancer. In this case, a complete axillary lymph node dissection may be recommended to remove most of the nodes in this area.
Radiation kills cancer cells by inflicting overwhelming damage to their DNA. The tumor shrinks as the cells stop dividing and die. If the tumor is in your head, your radiation therapist may make a mesh frame or mask that will keep you positioned correctly during the IMRT. Or you will get small permanent tattoos to help align the IMRT. Next, your therapist will do a CT scan of your head to get a detailed picture of your tumor and its borders. Your doctor will use the scans to specify the three-dimensional shape of your tumor and vital tissues nearby. The tumor's shape, size, type, and location help your doctor determine how the IMRT beam should be adjusted to hit your tumor and avoid healthy tissue. During your procedure, a medical linear accelerator will deliver an X-ray beam to your tumor. A computer inside the accelerator will adjust the beam with a device called a collimator. The collimator will adjust or modulate the intensity, direction, and shape of the radiation beam. This feature allows higher doses of radiation to be delivered to your tumor while sparing your healthy tissue around it. You may receive many radiation treatments over days or weeks. This allows your body to recover between treatments and to kill as many cancer cells as possible. Side effects are usually mild and occur only in the treatment area. Common side effects include localized skin irritation, localized hair loss, or inflammation and swelling near the tumor location. Chemotherapy drugs work by targeting fast-growing and reproducing cells, a characteristic common to cancer cells. The tumor shrinks as the cells stop dividing and die. Most chemotherapy drugs work systemically as they travel throughout your body in your bloodstream. As they circulate, the drugs damage metastatic cancer cells in other organs. Unfortunately, chemotherapy drugs cannot tell the difference between fast-growing normal cells and cancer cells. As a result, these drugs also damage or irritate some of your fast-growing normal cells, such as those in your bone marrow, digestive system, and hair follicles. Death, irritation, or damage to these normal cells produces side effects such as a weakened immune system, nausea, and hair loss.
Prostate cancer is a type of cancer that forms in a man's prostate gland. Most prostate tumors grow slowly compared to other types of cancer. Hormone therapy is another treatment for prostate cancer. It affects certain substances made by your body, called hormones. Prostate cancer needs these hormones to grow. Hormone therapy drugs can prevent cancer growth in two ways. First, the drugs can block the action of the one or more hormones on your prostate. Second, the drugs can block or reduce the amount of hormones made by your body.